Good morning. Thank you for joining us for one of our presentations for the 2020-2021 virtual McLean County Behavioral Health Community Forum. I'm Tricia Malott, and I am the county's Behavioral Health Coordinating Council Supervisor. And by attending this session, if you have not attended others, you are obviously aware that we've transitioned to a virtual webinar platform rather than an in-person event. And our planning committee took a great deal of time coming up with a number of topics that they thought were relevant to our community and the people that live within the county. Very specifically, we have also made many attempts to make sure that our presenters are representing local agencies or have a tie to the community in some capacity. The idea for the forum originated out of the Mental Health Action Plan that was approved by the McLean County Board in 2015 and has been an annual event. This is actually its fourth year. All prior events have been in person on a day in October. And while we are hopeful that we may be able to return to an in-person event in October later of this year, we are also really happy that you're joining us in this new way and have seen many advantages of this virtual capacity as well. So a few housekeeping things before we get started. You will be muted for the duration of the webinar. If you have questions throughout, there is a questions feature in GoToWebinar. Please type your question, but I would encourage you to make sure that you ask a specific question because questions will not be asked of the presenter until the end. And so if you ask a question such as, what does that mean, or what can I do about that, without context at the end of the presentation, our presenter will not know how to specifically answer that. So please make sure you ask specific questions. We do have a question moderator for this morning, and it's Kevin McCall, who is my behavioral health specialist here within our department. And so he will take care of reading all the questions at the end and ask them of our presenter. Hopefully you have no technology difficulties. All presentations are recorded and then uploaded to the BHCC YouTube channel after the presentation. And I'll also kind of direct your attention to the website as well. So on the county website, either on the homepage or by going to the Behavioral Health Department and the Events tab are some of our upcoming sessions. And I think for those of you attending this one, since this is addressing children, you may have some particular interest in some of our upcoming sessions which relate to keeping kids safe while using technology. We have an Ending the Silence presentation, which is actually targeted for adolescents. Generally speaking, from about 12 and up are the ideal ages for that particular presentation. So we did have one previously, which was Ending the Silence for Families, which is targeted towards adults. But this one is for adolescents to attend. We also have a crisis panel, which helps individuals know what services are available if someone is in a crisis, how they work together, and also how they're different. And some resources will be shared for that. And then we also have a presentation coming up on how to incorporate play and movement with kids. One, now that it's cold, but also while a number of folks are remote learning or inside. So hopefully there's something else that you find benefit in attending. And we look forward to continuing to see you. So our presenter this morning is, actually, I didn't ask Nona. I know so many different last names for you. Can you actually share your preferred last name?
Sure, it's Nona Waller, W-A-L-E-R.
Okay, thank you. So Nona Waller has been working with youth for over 10 years. She currently is a licensed clinical professional counselor and works with youth in the community through the McLean County Center for Human Services and Professional Associates of Illinois in Bloomington. She is active in the community and works with different organizations to promote behavioral health through teaching mental health first aid, collaborating with schools in the area, and encouraging youth and their families to find healthy ways to support one another. So Nona, we are appreciative that you are taking the time to be with us this morning, and you should now have the ability to share your screen.
Great. Okay. Let me, oh, no. Okay. Everybody, let's see. Yeah. There we go. Okay. Can people see my presentation screen? Great. Okay. Well, welcome everybody. I know this is kind of an odd format for some of us, but we'll get through it. Typically when I do presentations, I do try to get participation from the audience. Makes it a little bit more difficult when we're doing it virtually, of course. So every now and then I may ask you just to take a minute and, think of something or think about how you might respond to something before I move on. I encourage you to do that. It will help make it a more interactive experience for everybody. So. Thank you, McLean County Behavioral Health and the Health Department for letting us do this. It is a really important thing, and we're able to share a lot of information to a lot of different people kind of in one fell swoop. And it's awesome that they're able to put this together and virtually this year too. So that's really helpful. Thank you. Like Tricia said, I've been working with youth for over 10 years now. My range that I've worked with ages 4 to 18 plus. So I've seen a little bit of everything, not everything, but a little bit of everything. So what we're going to be focusing on today is mostly school age children. Infants and that age range is a whole other kettle of fish. So if you have questions pertaining more for infants and those kind of age ranges, you may not get as much information on that specifically today. But if you have specific questions, you can go ahead and ask, and I can do my best to answer. So. All right. So today we are talking about the shifts in mental health in children and adolescents. Obviously, this is something that anybody who comes in contact with youth, whether it's your own child, an extended family member, niece or nephew, cousin, student, client, kids are everywhere. And so it is important to kind of understand, well, what are the things maybe that we need to be looking out for? Maybe what are things that are a little bit more concerning? Where do we need to draw that line, that kind of thing? Okay. So what we're going to go over today, we're going to talk just briefly about what typical development looks like in various stages. We're not going to be talking about like physical development, puberty and all that good stuff, but more kind of the internal development that occurs. We're going to be talking about what changes in mental health look like. We're going to be talking about some behaviors to kind of keep an eye on, behaviors that might be red flags for other difficulties or future difficulties, that kind of thing. And then we're going to talk about not only what kind of resources are available to people in general and here in the community, we're also going to talk a little bit about, okay, so I'm noticing that my child or my niece or nephew or whomever seems to be struggling. What do I do about that? How do I talk to them about it? That kind of thing. What are some things to consider in that realm as well? Okay. So for development, we're going to be again talking more about the areas of development. We're also going to be talking about what does it look like when someone is struggling versus when one is being successful. Okay. So the areas of development that we are going to be focusing on today include behavioral, social, emotional, and academic. Behavioral development includes, rule following, the development of a moral and ethical identity and code in kids. And while that sounds really heavy, there have been studies that look at, very young children and their sense of fairness in different situations, their sense of, if something bad happens, what should I as a person do about that? It's very interesting to read studies, read papers, and that kind of thing about how kids who are really, really young can recognize differences in treatment, can recognize behaviors that we as adults would consider fair or unfair. Very interesting. Social development, again, from, making friends to dating relationships, relationships with family, that kind of thing. Emotional development, focusing mostly on emotions like you would, but not just understanding one's emotions, but being able to express them and express them in what we would consider an appropriate manner. So, not breaking things when there's a minor upset, that kind of thing. And then academics. Academics is pretty important, and it can be a good indicator of, how things are going for a child. And one of the reasons for that is that there's so much, kids are involved in academics for such a long period of time that we can kind of use that to look at how things are going in other areas as well. Okay. So if we're looking at a struggling child versus a successful child, we're going to go kind of by age ranges here for just a minute. So a preschool age child, preschool, kindergarten, we're looking at, if they're struggling, they're going to be often doing things like violating rules, being disobedient, that kind of thing. They're going to have more negative interactions, poor social skills, not able to verbally express their emotions, more acting out than being able to express things, poor adjustment to school, not interested in learning, and obviously a successful preschooler is going to be very much the opposite. They usually follow the rules, even if there's a hiccup or two, mostly good interactions with people. They're able to, identify, I'm sad, I'm mad, I'm happy, kind of those basic emotions. Maybe not something complex like I'm feeling ambivalent, but some of those, like I said, more simple emotions, that kind of thing. And then, having a positive feeling about school, positive experiences at school, that kind of thing. Elementary students, again, you're going to see kind of the same differences between a struggling student and a successful student. Changes that you'll start to see is kind of that developing a more specific code of conduct for themselves, knowing that I know that this is the correct behavior, I know that this is a hurtful behavior, and then adjusting their behavior to that effect. Becoming more able to solve social problems, sharing or conflict in sports, that kind of thing. And again, having positive peer interactions. Emotionally, the difference kind of comes down to, are they able to get past certain fears? Are they able to have a positive outlook? Are they able to, again, continue to express some of those emotions appropriately, especially if it's a really intense emotion, anger, sadness, that kind of thing. And then academically, we're looking at ability to pay attention, to complete tasks appropriately, manage their time, stay organized, that kind of thing. Okay. And then finally, adolescence. Again, I could have done a whole thing on just adolescence, the time frame and everything, because there are lots of things going on. But we're going to kind of keep it a little bit simple for today, just so that we can kind of have a good general idea of how to go through all this. But again, when you're looking at adolescence, very similar things. If a child is struggling, they're going to be, violating rules, not being aware that what they're doing is impacting the other people around them, not wanting to interact with people or interacting with maybe negative peers, that kind of thing. Having a negative outlook about themselves, negative emotionality, being depressed, anxious, angry, that kind of stuff. And then really struggling academically, not having really any interests in pursuing maybe additional education or even completing something like high school, not knowing what they want to do with their life, struggling in that way. Okay, and then obviously a successful adolescent is going to have much more awareness of their behavior. They're going to have more positive interactions with everybody around them. And what's typical in adolescence that I know a lot of parents struggle with is that the adolescent is going to shift from being more family focused to more peer and friend focused. And that's perfectly normal. That happens with everybody. And so I know there's a lot of parents that, well, they don't talk to me anymore, or we used to be so close and now they just go in their room and text their friends. And that's perfectly normal. It may be a difficult change for the parents and other adults in their life, but as long as they are reaching out and having those good positive peer relationships, there's usually not a lot to worry about in that area, okay? And then academically, finding out what they're interested in, learning skills, learning tools to be independent, that kind of thing, okay? So one of the other topics kind of in the same realm is the idea of change factors. So we're going to look a little bit at what are protective factors to help kids become more successful, what are some risk factors that can lead to more of a struggle, and we're going to talk just very briefly about ACEs. Again, I could do a whole presentation about ACEs and the ACEs study and that kind of thing, but we're going to consolidate it a little bit for today. So, all right. So protective factor is attributes and resources within a child or a parent family or peer group or the larger community that can shield the child from risks and help a child go down a more adaptive or resilient pathway. So again, what I want you guys to do here just for a second here, I want you to think of what are protective factors that you might be able to identify in a child's life. Are there internal factors you think might be protective? Are there family or social factors, community-wide factors, neighborhood, even things like cultural factors that could be positive in nature, that kind of thing. So take just 1 second to kind of think about that in your head, maybe jot down some ideas if you want. All right. So some examples of protective factors can include things like having the ability to have social skills and emotional regulation skills, healthy practices, so that can include things like, eating enough, eating a healthy amount of fruits and vegetables, drinking enough water, getting enough sleep. Those kinds of things can definitely be protective factors. I know if I have a rough night sleeping or that kind of thing, the next day I'm a little, and that goes along with our kids too. Having academic skills and being successful academically, feeling good about oneself, faith, hope, sense of meaning and control in their life, knowing that they can impact what goes on in their own lives, having a close relationship with a stable adult, positive, stable family environment, et cetera, et cetera, et cetera. So looking at this list, I want you guys just kind of in your head to think which one of these is the most important, because one of these factors has been shown to be more important above anything else. So I want you to think about that, and I'm going to give you the answer here in 5, 4, 3, 2, 1. Close relationship with stable adults. It makes sense. Again, relationships are super, super important for kids. The one thing that I always like to talk about with this is that stable adult may not be one's parent. Obviously, as a parent, you want your kids to trust and confide in you and that kind of thing. But it may be an aunt or an uncle or a coach or a teacher who they really have that strong connection with that really helps keep them being successful. And that's okay. And sometimes we as parents need to kind of take a step back and think, okay, you know, they're really close to Aunt Lauren. That's fine. I know that if there's concerns, Aunt Lauren will let me know, that kind of thing. Okay. Risk factors, attributes and resources within a child, etc., that can erect barriers and obstacles to development in a child. Again, I want you guys to think of what are maybe some internal risk factors within the child themselves that could provide difficulty. What are some risk factors maybe in the family setting, home environment, in the community at large, the school, neighborhood, that kind of thing, and come up with those for a second here, and then we're going to go ahead and look at some examples. All right, so some examples of risk factors, things that can make things more difficult for children. Early onset of behaviors, difficulties is definitely going to make a bigger problem than if it's a later onset of difficulties. Chemical imbalances, learned behaviors. So if you learn that when you get mad, you know, mom or dad punches holes in the wall, and you learn that that's how you express anger, and then you go on to express that anger at school or your job or that kind of thing, it's definitely going to be a risk factor for some negative stuff in one's life. Developmental delays, just having a difficult temperament, an authoritarian parenting style, so a very strict parenting style can be a risk factor. Adverse childhood experiences, which we're going to look at. Marital conflict at home. If your parent struggles with, you know, mental health issues or physical issues, that kind of stuff, that can definitely be a risk factor as well. An abusive home, if a child is taking medication, side effects of those, a low socioeconomic status, so poverty, lack of resources, that kind of thing, chronic illness, brain injury, cultural conflicts. Okay, and we'll talk about these a little bit more in detail. So, all right, so ACEs. So ACEs was a really big study that was performed, I want to say like 98, I think, something like that. But it was this really big study. Basically, it looked at exposure to childhood abuse and household dysfunction, and it correlated that to causes of death and other negative outcomes in adults. So basically, the study was saying, if you experience a negative thing in the home when you were a child, then you are more likely to experience these physical issues, these social issues when you're an adult. So the categories of risk that they looked at in the study included psychological abuse, physical abuse, sexual abuse, substance abuse in the household. Did someone in the household have a substance use problem? Excuse me. mental illness in the household, violence in the household, criminal behavior in the household. And so you go and you basically say, did this happen in your home, yes or no? Okay. And what the researchers found is a couple things. So first of all, and I don't have it on this slide, but if you answered yes, you experienced one of those risk factors in your home, you are much likelier to also say that yes, you experienced multiple. So if very few people experience just one, you're much more likely if you said yes to one to say yes to some of those other experiences. They significantly associate with the following conditions: depression, heavy drinking, smoking, lower educational attainment, unemployment, substance use, suicide. So a lot of different factors, and not only just things that we might think of like substance use, mental health issues, but also just straight up physical conditions, liver disease, heart disease, those kinds of things. And the key takeaway from that study is that these things are preventable. If you look back at the categories of risk, we can prevent things like psychological abuse, physical abuse, sexual abuse. These things are things that can be addressed in the home, that can be addressed before they become a negative influence on a child. Okay. So we're going to talk about what are things to look for when you are concerned. What are kind of those behaviors or those kind of red flags that you want to think about. And we're also going to talk about the idea of frequency, duration, and magnitude. So frequency, duration, and magnitude are really, really important. Basically, if you have those three things associated with negative behavior, the more of these you have, the more serious that behavior is likely to be. I always like to use the question of, has anyone who is watching have a bad day? Has anybody ever had a bad day, right? Have you ever had a bad day where you've struggled, where maybe you've felt depressed, you felt worried, you felt angry? And the answer is always yes, because we're all human. We all have experiences like that, right? So what's the difference between having one bad day and then the next day kind of bouncing back and being able to get back on a better mindset versus you have bad days for weeks in a row, or your bad days are so bad that you can't get out of bed? Right? Versus it's a bad day, but I can keep doing what I need to do. I can, go to my work, go to school, take a shower, that kind of stuff, right? And, again, do those bad days happen every day? Or is it, once in a while? Is it, I have a bad day, maybe a couple times a month, something like that, but I'm able to overcome it, right? And I think this is really important to keep in mind, too, with what we've been dealing with this whole year, is that there's been a big increase in things like anxiety, depression, not only in youth, but also in adults. And so I would say that for a lot of people, if they're thinking about, well, yeah, I have been having a lot of bad days. I have been feeling a lot of stress. It's been really, really hard. We need to keep that in mind as far as, well, okay, where is that coming from? Is that something that has come on with the pandemic, with various lockdowns, that kind of stuff? Is this something that is new since that started, or is this something I've been dealing with since before the pandemic? Either way, if you are experiencing a lot more symptoms, that's perfectly normal at this point in time. It's a normal reaction to an abnormal situation that we are all in. Okay. So frequencies, how often a behavior occurs. So once a week, twice a week, every day. Duration, how long a behavior goes on. So I was pretty upset, but by dinner time, I got over it. I was okay. I moved on to other things. Or I've been depressed and I've been depressed for a solid 2 weeks, you know, that kind of thing. And then magnitude, the severity of the behavior. So again, the difference of I feel kind of sad, I'm going to do something nice for myself, versus I feel so sad that I can't get out of bed, or I feel so sad that I can't take care of myself, can't take a shower, can't feed myself regularly, that kind of thing. And like I said before, the higher frequency, duration, and magnitude indicates more serious behavior, and behavior that maybe we need to take another look at and say, hey, is something going on here? Okay. And one of the reasons I like to emphasize these things is that, especially with adolescents, a lot of times we see adolescents as very moody or having a lot of these behaviors. And so I get a lot of calls like, my kid won't talk to me, my kid seems withdrawn, my child, all this stuff. And it's like, okay, the questions I always ask, how long has this been going on? How bad is it? Are they able to take care of themselves? Does it happen a lot? And that will inform me as a clinician as to, okay, maybe this is a mild set of symptoms, maybe it's a more moderate set of symptoms, maybe it's a more severe set of symptoms, and we need to address it appropriately. Okay, so specific behaviors that are important to look at when we are questioning, okay, something going on, do we need to look more into this, have that conversation? So changes in physical state. So for this, we're talking about things like appetite, sleep, energy, weight. And again, you have to take all of this into context. If it's a teenager who for finals week is not sleeping at all, they're pulling all-nighters and isn't maybe eating regularly, are they able to do so when it's not finals week? Or is finals week kind of an intense stressor that is causing some of those changes? If the weight loss is intentional or not. That can also be a key thing to kind of identify and say, okay, are you losing weight because you're having some poor body image? Are you losing weight because you're just not eating? Are you losing weight because you're on a medication that dulls your appetite? All those things need to be taken into consideration. Oh, and somatic symptoms. So things like stomach aches, headaches, random aches and pains. Sometimes, especially with kids and things like anxiety, those can pop up as more of a somatic or a physical complaint rather than them being able to say, I'm worried about something. If they always get a stomach ache before they have to go to school because they are worried about school, that could be a sign that maybe a conversation needs to be had. Okay, changes in emotional reactivity. So things like moodiness or having extreme changes in emotions, going from, top of the world, everything is amazing and I'm awesome, to I'm a terrible person, I shouldn't be here, I need to hurt myself. Going between those two extremes can definitely be something that may need to be addressed by a professional, or at least kind of noted and maybe, again, have that conversation, okay? Again, when we're talking about adolescence, you want to look at the frequency, the duration, and the magnitude. There is a normal range of emotional reactivity in teenagers, especially ones that are, going through puberty or maybe having some hormone cycles and that kind of thing. So we always need to keep in the back of our mind, how often is this happening? How long is it going on? And how serious is it? Okay. Anxiety and fear, again, same thing. Is this an anxiety that seems more rational maybe? I was in a car wreck last year, and so now I get nervous when I'm in a car, but I can still go places. It's not keeping me from going places. Versus, I can't leave the house because I'm too scared to, or, I'm always worried. I'm always worried about everything. I always think something bad is going to happen, even though there's no real evidence that would happen. Tantrums, again, when you're looking at younger kids, they're going to have tantrums. As they get older, most kids, grow out of having what we might consider a tantrum, kind of all out, yelling, screaming, crying, that kind of stuff. So is that still happening? How often is that happening? What's triggering that? Could be if it seems that it's a big thing that is happening a lot and lasts for a long time. They can't calm themselves down for a couple of hours. That could be a sign that, hey, maybe this is something we need to maybe look into, ask some further questions for. Okay. Tearfulness, again, same thing. If you get a bad grade and you feel disappointed and sad, that could be one thing, versus crying for no reason and doing so, most days than not, for no reason. Again, definitely something to keep an eye on. Okay. And then, sorry, hold on. Changes in social activity. Oh, I'm sorry, hyperactivity. My mistake, my screen got covered there for a second. Hyperactivity and impulsivity. Again, if this is affecting their ability to function, are they, suffering academically because they just cannot pay attention, they cannot stay organized? Is it costing them relationships at home because they're all over the place? That kind of thing. That can definitely be questions to ask. Is this something that happens every day, or do they just get really excited because it's Christmas? Frequency, duration, magnitude. Changes in social activity. So withdrawal from friends, activities, and family. Again, with adolescents, you typically see more of a withdrawal from family and more interest in peer groups and that kind of social interaction. But if you have someone who is withdrawing from everything, maybe they really like to play basketball and now they have no interest in it, and they're just keeping themselves in the room, and they're not spending time with friends. All those things added up together, maybe that's a conversation that needs to be had. But if it's, well, they don't talk to me as much as they used to, now they just want to talk to their friends, and they used to be into basketball, but now they want to go into baseball, that's more typical, more normal. Rule violating behavior, again, we look at the seriousness of this. If you tell a preschooler, no, you can't have a cookie, and they take a cookie before dinner, I would say that that's quite typical. But if they are, using ways to get what they want, knowing that there's going to be negative consequences, and they're doing it consistently, or it gets to the point where, maybe the legal system has to get involved and that kind of thing. The police are involved. That could be definitely time for a conversation. Decrease in academic achievement. Again, I kind of said before that because kids are in school for so long, if you look at their academic achievement and you notice a progressive down pattern, that can mean a lot of different things. Do they need help in a specific subject if they just always struggle with math? Do they need to maybe be tested for difficulty learning in that area, that kind of thing? Is it a reflection of maybe some depression or that kind of thing? So if you have concerns, if you're seeing a general downward negative trend, again, that might be a time to have that conversation of, what's going on. Okay, increase in defiance and opposition, similar to that rule violating behavior. Is this just typical, I want to do this because I'm a teenager and I think I can do it, or is it I'm going to do it and you are not going to stop me, and if you try to stop me, then things are going to get ugly. Changes in thought patterns, frequent self-criticism or blame. We all kind of have that negative voice in our head that sometimes says, you did not do this very well, did you? But that is something that is happening all the time to the degree that it's causing difficulty functioning. That could be a problem. Racing thoughts. I know some of us, I'm going to out myself here, sometimes if I'm lying in bed and I just start thinking about all the stuff I have to do tomorrow, I can get a little bit caught up in that. But if you're able to kind of stop yourself from having those racing thoughts, give yourself a way to calm down, that kind of thing, versus these racing thoughts are kind of taking over. I'm not able to focus on anything because I'm just worrying, or just having so many things going on in my head. It's affecting my ability to do what I need to do. Seeing and hearing things others do not. So this is an interesting one. I know that there's a lot of like, oh, ooh, that's the big one. That's a scary thing. It's not really necessarily as scary as one might think. A lot of times when kids are experiencing this, it's not a sign necessarily that they're, have schizophrenia or things like that. Seeing and hearing things can range from, I have an invisible friend, to maybe they're experimenting with some drugs or that kind of thing, substances that might have that effect. And sometimes, even if someone does report seeing or hearing things, it isn't disruptive to them. So there's a difference between hearing a voice that's telling you to hurt yourself or hurt other people, to maybe hearing a voice that you think is, your grandmother's voice, and finding some comfort in that. But if you do have concerns, or if you notice that this is causing some other difficulties in a child's life, again, that conversation is a good thing to have, just to make sure to address those concerns on our part as adults. Delusional thinking, again, same kind of thing, ranges from, I have an invisible friend, to I'm going to be the next Michael Jordan, and it's like, no, sorry, no, you are not going to become the next Michael Jordan, because it is not in your cards, and that kind of thing. But if it gets to the point where it's causing an impact in their life, if it's happening a lot, that kind of thing, again, another conversation might need to be held. Thoughts of death and suicide, we'll talk about this in a minute here, but those are always big red flags. So whenever you have concerns, or whenever you are aware of a youth talking about death for themselves, talking about dying, killing themselves, hurting themselves, that's definitely something that needs to be addressed. And sometimes it is a matter of, I'm so mad, I can just kill myself, versus I'm truly depressed and I really do, I'm planning on how to hurt myself, that kind of thing. But it's always worth a conversation if that comes up. So some red flag behaviors, kind of like I said before, suicidal thoughts and actions, self-harm behavior, threats of violence towards others, feelings of helplessness and hopelessness. So not feeling in control of their life, not feeling like they're going to have a future, or that their future is going to be a positive one. Extreme weight loss or gain, this can be a really big issue just physically. It can cause damage to the body physically, and may require, medical intervention, that kind of thing. An increase in drug and alcohol use. Again, not only can it be detrimental to these physically, but it could also be tied into maybe some other things going on in their life. An increase in interaction with the legal system. Again, so if, maybe you got in trouble a couple times at school, had to go to the principal's office once or twice, and now they are consistently having interactions with police. They're getting found to be going off on curfew, or that kind of stuff. That could be a sign that something maybe is not going the right way. If these occur, or if you have concerns, again, please talk to the child immediately, or discuss the situation with a professional. And we're going to talk about, okay, well, how do I do that? And who do I do that to? Who do I do that with? Who can I rely on? Who can I ask? And then obviously in any life-threatening situation, call 911. If, someone says, or if a youth says that they have taken steps to hurt themselves, they have, taken pills, or they have attempted to cut themselves, that kind of stuff. If it's a life-threatening situation, always call 911. Okay, so how do I approach kids? How do I, if I'm concerned about them and, I want to have maybe that conversation about, okay, well, what's going on here? What do I need to keep in mind? The first thing is you always want to work on keeping that door open. One of the things that I teach in mental health first aid is the idea of maybe they're not going to talk to you right this second, but if you keep that door open, they may then approach you later on when they're in a better place, ready to share what's going on. So using I statements, I feel this, I notice this, I have been concerned with. It's a lot less judgmental. It's a lot less guilt, shame, anxiety provoking than, well, you're doing this and you're doing that. The tone is just completely different. Being respectful and genuine, being positive with feedback, being aware that the child's feelings are very real. So even if, we as adults can maybe handle getting a bad grade or having a breakup or getting in a fight with a friend, because we know that things will, again, turn out okay in the end. If it's, the first time that that's happening to that child, or if it's, maybe not the first time, but it's something they were really, really had strong feelings about, we have to accept that what they're feeling is real. We can't say, well, no, you'll be fine, just get over it. We don't want to dismiss their feelings, okay? Be accepting even if you disagree. So I see this a lot, again, with teenagers especially, where, oh, my parents are terrible and awful and horrible, and, they make me go to bed, and they, make me do chores and that kind of stuff. Even if I think that, well, that's pretty normal, it's pretty typical, if I dismiss the feelings behind that, it's going to close the door on that conversation. So it's like, it sounds like that is a really stressful thing. Like you feel like your parents are way too strict on you. And then go from there. And then finally, sharing what you see. I think that this is a really helpful thing. If you say, if you note specific behaviors that you have witnessed, I see that you haven't been eating. I see that you've been crying a lot. That kind of thing. It's a lot less judgmental and a lot, you're gonna get a lot less reactivity from your youth when you're approaching them than if you say, well, you're losing weight, you're doing this. If you say, these are the things that I've noticed, these are the things I've observed, it comes off much less judgmental. And then again, the don'ts, again, being judgmental, criticizing, patronizing, especially teenagers, because they can smell that a mile away. Sometimes pushing for more information than the youth is comfortable sharing at that point. Maybe they're willing to share just a little bit about what's going on, but they're not ready to, open it all up. And that's okay. You want to keep that door open, okay? Don't dismiss their problems. Oh, you're just a kid. Oh, it doesn't matter. Oh, you'll get over it. Don't try to fix the problem yourself. Sometimes, just like with adults, kids just want someone to listen to them. They know that we can't fix the fact that Bobby wouldn't play with us at recess. They just want to tell you that Bobby didn't want to play with them at recess and it made them feel sad and they had to go and do this other thing instead. And then don't tell them how they feel or should feel. You're not them, they're not you. And even if it's a situation where as an adult that they can bounce back from it, that there will be more positive things in the future, at that moment you need to respect what they're feeling and what they're thinking. Okay, so the next steps, again, how do you approach with your concerns? What are some resources that you can look towards? So some sample phrases, just because, again, sometimes it's helpful to have some just vocab for you. I've noticed you've been spending a lot of time alone in your room lately. How are things with your friends? You haven't been eating a lot recently. I'm concerned that you've lost weight. you appear to be pretty down this week. Is everything okay? And I did talk about open-ended versus closed-ended questions, but a lot of times a way to keep that door to communication open is to use more open-ended questions. Things like how, what, why, basically questions that don't rely on a yes/no answer. Teenagers especially are very good at being like, how are you doing? Fine. You having any problems? Nope. So sometimes finding a way to talk to youth that doesn't rely on that yes/no format can get you a lot further. Okay, so professional resources to help. If you determine that, maybe it's a situation where we need professional help, absolutely, or maybe it's, I think maybe we need to talk to somebody, but I don't know who I would start with. Here's some ideas to go with. The people that a lot of times see our kids, even before someone like me, a mental health professional, does, is their primary care doctor. Again, sometimes it involves some of the somatic things, if they're having a lot of headaches or stomach aches or whatever. And sometimes it's, at the yearly physical, the doctor will ask questions about how have you been feeling, have you been depressed, that kind of stuff. So a lot of times the primary care doctor is a good first step. Okay, school professionals. Again, kids are in school for most of, their youthhood. So professionals at school that have, again, extra training and are with students often can kind of see, okay, is this typical for this age or this kid, and kind of catch some of those as well. And that can include school counselors, social workers, psychologists, the nurse. Again, if you have a kid that's going down to the nurse every day because they're having stomach aches before they have a math test, and every time they have a math test, they end up in the nurse's office. That could be a clue and someone to talk to about, hey, is this typical, or, do we, maybe need to address this somehow? And then obviously general mental health professionals. So that could be a therapist, could be a licensed social worker, a psychologist, psychiatrist. And again, I know that we're not doing a whole lot of interaction here, but I want you to think if you know the difference between a psychologist and a psychiatrist. And I'll give you 1 second to think about it. What's the difference? So the big difference between a psychologist and a psychiatrist is that a psychiatrist can prescribe medication, a psychologist cannot. So a lot of times if you're looking for testing for maybe ADHD or that kind of stuff, some psychological testing, you're going to go talk with a psychologist. If you're looking for more for medication, a psychiatrist is what you're going to be looking at. Okay, and a note on that, again, another reason to go to a primary care doctor. In our county, unfortunately, we don't have a lot of youth and child psychiatrists available. So I always encourage parents and families, go talk to your primary care doctor. There's a lot of primary care doctors who are open to prescribing, low levels of different medications, and they may also be able to make a referral to a psychiatrist outside of the county if they deem that as appropriate. Okay. Local professional resources, some more specific ones. In McLean County, the Center for Human Services provides mental health counseling, can take various insurances depending on what it is. And that's where I work. We primarily work with kids who have Medicaid, that kind of thing, but we're also able to accept some insurances. And there's the phone number there, although that phone number is incorrect. I'm not sure why that got centered like that, but I can give you the correct phone number. It's 309-827-5351. So just ignore the 3 and the 4 there if you're writing this down. Whoops. Okay. Chestnut Health Systems also provides mental health counseling, substance use counseling. Their phone number is there as well. Project Oz, they focus mostly on things like homeless youth, runaway youth. They do a lot with prevention, that kind of thing. Their number is there as well. The Center for Youth and Family Solutions, they have SAS crisis services, which are short-term crisis services for youth. They also provide things like mental health counseling, that kind of thing. Okay, and I can go back to this slide, or are people going to have access to the slides, Tricia?
So they, we can send it out,
Okay.
but generally we've left it that everybody has access to be able to get to the BHCC YouTube page so they can watch the recording at any point.
Perfect.
But we can also send it out too.
Okay. Well, and if people aren't able to write this down again, at the end I can go back and have this pop up so people can note down some numbers and that kind of thing. The other resources that I really wanted to point out are more emergency type resources. And so these are resources you can use when there's risk of immediate harm. If you're looking for referrals for other ongoing resources, these are definitely the people that you can contact as well. So again, 911 if it's a physical emergency, if you are concerned for the safety and well-being of whoever's in the home, in the area. And then if you do call 911 and it is a mental health emergency, I would always say that to the 911 operator. They can sometimes kind of tailor who shows up to address the situation. Some law enforcement and first responders may have some extra training in mental health that would allow them to maybe address the situation a little bit differently than kind of their non-trained colleagues. So I would always encourage you, if you do think it is a mental health emergency, to say that. PATH, and I included this in the crisis resources. That's also just a good professional resource in the county. And actually, they cover a couple of counties, I think, or they have information for a couple of counties. But it's a 24/7 resource and referral network. They do everything. I love PATH. I always talk about it with new clients and that kind of thing. They do everything from having just someone that you can talk to if you are having concerns, if you're feeling upset yourself. You know, they're kind of a good hotline, just 24/7. They do answer for the National Suicide Hotline, so they have that training as well. If someone is feeling depressed or suicidal, they can call the PATH hotline, have someone to talk to that has some training in that. Again, they're able to give resources, you know, if you call and say, I don't know where to go, this is what I'm dealing with, having mental health issues, my child is, even up to, you know, I need help with rent. I mean, they really do everything. So I always encourage PATH as a good resource for everybody, especially if you're like, I have no idea where to start. I don't know. ECI is the crisis team through the Center for Human Services, and basically any person who has commercial insurance, so Blue Cross Blue Shield, Health Alliance, those kind of things, you can call the Center for Human Services office, get a hold of the crisis team. You can also get a hold of them through the PATH hotline as well. And I know a lot of people may be a little bit worried, okay, if I call for a crisis team, does that automatically mean hospitalization, that kind of stuff? And it really doesn't. Sometimes it is just a matter of talking to somebody over the phone, having them do some safety planning, figure out, you know, the next couple steps for them. It doesn't always lead to going to the hospital or having to be hospitalized. I know that's a concern, a fear for people and parents. And then the SAS team, which is the crisis team for youth up to age 21 who have Medicaid or no insurance, and that hotline number is there too. If you are confused by, well, I don't know who to call when, call PATH. path will get you on the right path, as it were. You know, if you have questions about, well, I don't know, this is my nephew, I don't know if they have insurance or what it is or any, call PATH, and PATH will lead you in the right direction, and can explain, you know, what are the differences between all of these resources and that kind of thing. Okay. And then obviously there's a lot of resources that I haven't talked about because we do have a lot of resources here in the county. So if you're like, but you didn't talk about this thing, I apologize. And we can, you know, definitely add on. Again, I don't want to, I have a time limit, so we're going to try and keep on that. Okay. And then for those who are interested, you know, this is where I got most of my information. One of the things I will point out is this article, Lady Vincent et al., Relationship of Childhood Abuse and Household Dysfunction. That's the ACE study that I talked about a little bit earlier. You can find the paper online. If you look up ACEs, there's like a CDC website that talks about it and how to prevent ACEs and those kind of things. The other thing that I'm going to give a plug to, as long as I'm here, is mental health first aid. So we as a county have been really blessed with getting assistance, getting monetary financial assistance with getting training, that kind of thing, for mental health first aid and for youth mental health first aid. So if you have not taken either of those courses, I would really, really recommend them. Again, if you are more focused on youth or you, you know, work with youth, that kind of thing, I would probably recommend the youth course over the adult course, but they're both really good. They're both going to teach really good ways of how to identify mental health crises, how to address them, how to approach people, how to share different information. So that's my little plug for mental health first aid. And yeah, that is my presentation. I'll move it back to the local professional resource page, and then I don't know if we have questions that people have brought up or where we're at with that.
We don't have any questions yet, and I will remind folks that if you have questions for Nona, to put them in the question box and we will ask them of her so she can provide answers. In the interim, we will also put the link for the BHCC YouTube channel so you can have easier access to see this recording and other recordings for our presentations, and also the direct link for the county website for upcoming registration events. And so we know that sometimes it takes a few minutes for people to send their questions and messages in.
Sure.
Nona, I want to thank you while we wait for taking the time this morning. And I think for any of us who have been on the presentation, who either work with kids or have our own, there's so much helpful information that you put in here. And I think it's really helpful, especially now that you normalized the experiences that kids may be having in the midst of COVID-19, and that we're all experiencing an abnormal situation. And so there may be some fluctuations with that as well.
Yeah, and I can talk just a little bit more about kind of what I've seen as far as with the pandemic and that kind of thing, because I have definitely had some kids who, again, kids are very social, and so not being able to kind of see their friends, do things with their friends, has really, for some kids, really hit them hard. And, you know, having that balance between, you know, what is a safe activity to do versus what is a socially healthy set of activities to do, I know has been really difficult for a lot of people to kind of decide and walk that line. And then I would also, especially for those who have, school-age kids, I know that with the going back and forth between remote versus hybrid versus we're back to remote versus, well, now our schedules change again because of, whatever factor. Just know that as an adult, I know that for myself, it has been very stressful to kind of keep up with all of that. We work a lot in the schools and with the schools, and so my staff has had to do a lot of mind shifts as far as, okay, wait, so I can go to the building, or I can't go to the building, or this is when this kid is free, and this is, so there's been a lot of having to be flexible for my staff and for us adults. And sometimes we forget that our youth are having to do those exact same things with less experience, less benefit of prior experiences to where they can kind of get an idea of how to manage those changes, that balance. And so if you have a youth who is struggling in school this year, be aware of what they're going through. And again, when I talk about that approach, if they're feeling stressed out because they can't handle being on a Zoom call for 6 hours a day, that's legitimate. That's legitimate. And are their grades going to suffer? They might. Does that mean that they're not trying? Absolutely not. But the way that we are used to focusing our energy on things like that is incredibly different than how we've done it in the past. And you combine that with, again, not being able to engage with peers like we used to. Put all that together, and there's a lot of kids who maybe they're not doing as well academically or that kind of thing, or they seem to be, having a bad year, but they're probably doing the best they can, and they're probably putting as much effort as they can into the things that they can do and the things that they can control. And so we as adults, as parents, need to be able to show them some grace and some understanding of, I get it that you can't concentrate because you're stuck in the house all day and you're stuck on the computer in the house all day. You don't have that physical break and that physical input, sensory input that you would have if you were at school actually doing stuff and doing labs and doing hands-on things. The computer is a wonderful tool, but it can get very exhausting to do everything on the computer, as I'm sure most of us know and acknowledge and maybe have experienced for ourselves.
Thank you for adding on to that. As a professional and as a parent, I think it's really helpful information. And so I'm hopeful that our attendees also see the value in really you normalizing a lot of what kids are experiencing right now. I'm going to hand things over to Kevin. We have not necessarily questions, but we do have a couple of comments that have come in. So I'll let him take over.
Yeah, sure. So it doesn't look like we actually have any questions today. You were very thorough, and I've had the pleasure of seeing Nona present before, and she's usually very thorough, so I'm not surprised there's not a lot of questions here, but we do have a couple of thank yous. The first one from Jessica Hoy says, thank you, Nona. That was really informative, and I really appreciate all of your examples. Yeah, definitely a lot of really good examples in these presentations. And then another one from Carson Cross who says, thank you, Nona, from the folks at Camp Shawa Nasi in Manteno. Your presentation was insightful, and this free resource is greatly appreciated. So a couple of great thank yous, and thank you for me as well, Nona. You did an excellent job today. Thank you very much.
Yeah, I'm glad that I could share some information. and that kind of thing. And to go kind of back on to 2020 a little bit, the other thing, again, that we really don't have time to go into in a lot of detail, but something that I want to point out is the national tension and unrest that we had during 2020 is also something to keep in mind for our kids, for our youth, even if they're not at the age where they're maybe totally aware of everything, of all the controversies and that kind of stuff. We as the adults in their lives are probably more aware, and we can very easily project that stress onto the kids that we work with, that we see. And so being aware of how we as the adults in our lives are dealing with those kind of stressors is also really important, because kids are very, very perceptive. And even if we don't think that they're listening, a lot of times they're listening, and for better or worse. So making sure that if we are having stress, if we are finding it difficult to do what we need to do as adults, taking care of ourselves is a lot of times the first step into taking care of our kids and our youth.
All right, well, we have had no more questions come in, so we will wrap up. Thank you for presenting this morning, Nona. And I echo what Kevin said. It was a very thorough presentation, and the examples I think were spot on. So to everyone who attended this morning, also thank you for giving us part of your morning, and we hope to see you in one of our future sessions. Have a good rest of your day.
Thank you.